You're watching News9. A newborn baby is looked after like a fragile object, but very often proper medical care is something that is not available to many babies. In fact, in a country that has one of the highest infant mortality rates, neonatal care is one aspect that is still sadly neglected. Let's take a look at how important neonatal care is and how your precious little baby needs. Welcome to Neonatal Care, and I'm Niranjan. Of course, nothing can be more painful than going through the entire period of pregnancy and then losing the baby due to poor neonatal care. Proper neonatal care ensures that a baby leaves the hospital safe, sound and capable of surviving the crucial first few months. A large portion of the mothers in India do not know about neonatal care, and improper neonatal care causes temporary or permanent damage to the health of most children. Most of the parents remain ignorant about it, even though neonatal deaths account for more than 50% of the infant mortality rate. Premature babies often have underdeveloped organs that make it tough for them to survive outside the womb. Neonatal care takes care of such babies till they are healthy enough. Currently, the number of neonatal care units are not adequate enough to house each and every newborn and give them required care. Well, it is time for us to ensure that a newborn is not just born healthy but also stays healthy. Let's just give you a few facts. India accounts for almost 1/4 of the total global neonatal deaths, with over 1 million newborns dying after birth. The urban poor in the state of Uttar Pradesh registers about 26,000 births per year. Among these, 18,000 of them are delivered at home, and most of these parents lack awareness. Poverty often pushes newborns to inadequate care during pregnancy, delivery and postnatal period. Of course, such babies fall prey to ailments like cold, diarrhea, respiratory problems and fever, and due to the delicate nature of babies, well, these common ailments could even take the lives of the kids. And there are, of course, several types of neonatal care. Intensive care is the highest level of care and is reserved for babies that are severely underdeveloped or have severe medical conditions. High dependency care is for those babies that require breathing assistance for the first few days after their birth. Special care is for children that may or may not need oxygen but are stable enough to be handled and a bottle of breastfed. Transitional care is for those babies that are preparing to go back home. In fact, we're joined today in our studios by Dr. Kishore Kumar. Thank you, Dr. Kishore, for joining us. He's the consultant neonatologist, and he's also the CEO and managing director of the Cradle Hospital in Bengaluru. Doctor, let's start off by talking about the importance of neonatal care.
See, the neonatal care is very, very important. As you highlighted a lot of the points here, it's very crucial that we have a good neonatal care. The fact is 90% of the babies are born with no care that is required. 10% of babies will need some sort of neonatal care to make a good transition into life. Otherwise, we are putting 10% of our babies when they are born into risk when we don't have a proper neonatal care. 90% will not need any neonatal care and they do well. So that's where the problem comes, because most of the time this 10% is ignored. And when you don't have facilities, it's the 10% which suffer.
That's right.
And when you have a high birth rate like India, you are going to definitely have a high mortality, because 10% of the babies are not getting that care.
Of course, you're a neonatologist. So if you look at the scenario in India, why is it that there is no adequate facilities? Is it because the government has probably not paid attention, or is there some kind of an ignorance on the part of the medical fraternity itself? They're probably not venturing much into that particular.
I wish I can answer you in one point, but the answer to this question is multifactorial. One is neonatal care as such, or neonatology, is a young branch of medicine. It's only 50 years old. The term neonatology was coined. 50 years ago or before that, if a baby doesn't breathe at birth, nobody dared to do anything. Even 20 years ago, when we were or 25 years ago when we were doing post-graduation, the only neonatal care which most of the medical colleges in Karnataka knew is keep babies one next to the other. So neonatology has evolved over a period of time. And during this time, India is lagging behind, number one, lack of professionals in all areas. Bangalore is well served, but a lot of rural areas are not well served. Second thing is government institutions which account for 90% of the births in India do not have proper neonatal care. Take for example any name in Bangalore. If you take a maternity government hospital, most of them don't have a proper neonatal care. So 90% of our population go to the government hospitals. It's not that the government can't afford, it's multifactorial. The funds don't percolate to the level which is required. The people who are working are not interested because nobody raises the voice.
In short, it's been ignored.
Absolutely.
It's been ignored because obviously you're saying there is corruption in this system as well, that they haven't really spent the money in the right manner.
More than the corruption, I think it's lack of awareness and lack of accountability, lack of awareness and those sort of the issues. See, for example, take for example Australia. Australia has been known for all wrong reasons in the media recently, but in Australia if a baby is died or dead, every baby's death has to be accounted for, why it died and what was the reason, who was looking for, and what could have been done better. So the lessons are learned from that. Whereas here death has no value. So in the sense if a baby dies, that's the end.
Nobody cares.
Nobody cares. So that attitude has to change. Every baby has a life. Every baby has a right to live. Whether it's poor family or a rich family, every baby has a right to survive and they have to be provided appropriate services. And the best way to do that is every person who's going to deliver should ask the concerned hospital, do you have neonatal care? And if you don't have neonatal care, how are you going to cope if my baby has this problem? And the only way that can happen is public education like your channel is doing for neonatal care.
So obviously education is lacking right now. That's what you believe, and that is the situation now.
Education is the beginning. Once people are educated about the need for neonatal care, then comes the accountability. Yeah, my baby was born and he didn't cry. And what did you do? Because your hospital was responsible.
That's right.
So if people start asking questions, then everybody will be accountable. Then people start looking.
Okay, let's take a city like Bengaluru. So in Bengaluru, how many hospitals, or let's say you were speaking about a general figure, 90% of kids are born in government hospitals, and the government hospitals don't have proper neonatal care facilities. But in Bengaluru, what is the situation?
In Bengaluru, the only government hospital which has a neonatal intensive care, for example, is Indira Gandhi Institute of Child Health. But it doesn't have the maternity services. Any government hospital which has maternity services doesn't have level 3 intensive care which is required. As I said, 90% of the babies don't have a problem, but 10% of the babies who have a problem will need intensive care, and that's when situation warrants.
Okay, in terms of the intensive care unit and the neonatal care facilities, what is the kind of facilities we're talking about that is required in these hospitals, right now?
Okay. The facilities, as you highlighted appropriately, you have intensive care, high dependency and special care. And you need intensive care and high dependency because, as I said, 90% of the babies don't need anything. But it's 10% of babies who will need intensive care and high dependency. And if you don't have an intensive care and high dependency, you can't help babies transit properly to the external world.
Okay. And how bad is the situation right now? Because we know that there is only 50% mortality of babies that are born prematurely. So obviously a lot has to be done, not just in the city. If you're talking about facilities lacking in the city, then the situation is much worse in the rural areas. So what can be done now going further?
More than the lack of facilities, the awareness is first and foremost important. Say for example a baby is premature or a baby is born less than 34 weeks. They should not be born in a place where there is no neonatal intensive care. Whether it's a nursing home or a private hospital or any hospital for that matter, if a lady walks in labor and she is going to deliver a premature baby, they should not be born in a hospital where there is no neonatologist or no neonatal intensive care. The reason being, the first hour of life, we call it as a golden hour, is the most crucial. As soon as the baby is born, the baby has to cry, the lungs has to get out, get rid of the fluid in the lungs and get oxygen replaced. During this process, the blood pressure fluctuates and the blood pressure has to be maintained well. The oxygen level has to be maintained. The transition of the baby from inside the womb, where it is filled with fluid, to external world, where it is fluid filled with air, has to be perfect. And to happen that transition, premature babies have a high risk. So no baby ever, anybody under 34 weeks, because pregnancy is considered as 40 weeks. So anybody under 34 weeks should not be delivered in any hospital where there is no neonatologist or no neonatal intensive care.
Okay, and when you're talking about, the facilities, like you said, is very minimal, especially in rural areas, and even in a city like Bengaluru, a few hospitals have that. So is there anything else that the parents can do to ensure that if a premature baby is born, they take adequate care of that? Is there something else that they can do apart from bringing them to adequate facilitated hospitals?
The first and foremost important babies die of in India is hypothermia. Hypothermia means the babies get cold. You have to understand that as soon as the baby is born, the baby is coming from the womb of a mother at 37 degrees Celsius to room temperature of 22, 23. For them it's like going from Bangalore to Antarctica. So the transition from the baby's, from the mother's womb to room temperature has to be gradual, and the baby has to be kept warm.
Okay.
So to keep the baby warm, the baby has to be dried, because babies can lose temperature from conduction, convection, radiation, everything. So baby has to be dried because they are all covered with fluid. And the best way to keep the baby warm is actually keeping the baby in the mother's chest in a facility where there is no other facilities. The second commonest reason why babies die soon or have problems soon after birth is low blood sugar, what we call the hypoglycemia. To prevent that, you have to initiate the breastfeeding within 1 hour after birth. That takes care of the need of the baby to sugar levels. Because if the sugar levels come low, then definitely that can cause problems in the baby's brain development and also convulsions and various things. So if the baby doesn't breathe, or if the baby doesn't keep their temperature, then obviously that baby needs to be attended to by the expert quickly.
So obviously, so at the end of it, we know that it's the most important thing, and the mortality rate, of course, is alarming right now. So would you want to say something finally to all our viewers today about the importance of this neonatal care?
The most important message I can give for all the viewers is, look, 90% of the babies when they are born, there's absolutely no problem because nature takes care of it and God is great. It's only 10% of the times when the baby doesn't pass through the transitional frame from inside the womb to outside the world in a proper way. That's when you need help. Now the question is, there is no way to predict a baby who is going to have a problem. So you need to ask question, am I safe? Or is my baby safe in the place where I'm going to deliver? And if you feel that you are not going to get that 10% care, in case if there's a problem, you should not deliver in that place.
Fair enough. Thank you, Dr. Kishore, for joining us today. Well, so neonatal care is very important. Make sure that if you go to a hospital, there is adequate neonatal care facilities. That is very important. But let's tell you that the mortality rate is really alarming. It's about 50%. So make sure that if you're delivering a child, or if someone needs good care for their baby, make sure that there is adequate facilities. This is what we've concluded. Let's move on now. With the BBMP elections around the corner, Bengalurians have decided to show that they do care for Namma City. They are coming out raising the issues that matter the most. Jay Croster, the president of the FKCCI, reported for News9 the problems that people of his area face. We'll leave you with this.